Everyone, I am Dr. Fong, and today I am doing an IG Live on eczema and toxins. And I think this is a very interesting phenomenon that most of us never put this together. And this is something I only put together because I personally am an eczema survivor. I was born with eczema, and I suffered with eczema through 30 years of my life, and only about 8 to 9 years ago did I conquer my eczema. This was after I became a naturopathic doctor, and I really had to understand what the root causes of this painful, itchy skin disease really were. And in learning about how to treat myself and heal myself of this painful, itchy skin disease, I really learned that the root cause of eczema, part of it really lies in toxin overload. And so what I like to say is that everybody has what I like to call a detox funnel. And that detox funnel is made up of all of your detox organs and pathways. And if you break it down to just kind of 4 things to make it really simple, it's your gut, your kidneys or urinary system, and your liver. And then something called bile, which your liver makes, is also very important as well too. And what happens with this detox funnel is that, toxins, hormones, fat need to go through this funnel, and they need to exit out of our system. But what happens in an eczema case like mine and many of yours is that this funnel is getting clogged, it is getting filled with toxins, and it's overflowing. And what you are experiencing when you are experiencing eczema is really really an alarm system that's indicating that this funnel is overflowing. And there's so many reasons that this funnel overflows. So, the first one, of course, is if you're filling the funnel with lots of toxins, so heavy metals and environmental toxins. Some of those we know about, and some of those we don't know about. Some of those we're exposed to, and we really have no idea we're exposed to these toxins. I get a lot of questions about, well, how does my baby have eczema? My baby's just been born into this world. And unfortunately, us mothers, when we are carrying our children, we are potentially transferring toxins into our babies through our placenta. And then when they are born, we are also transferring these toxins via the breast milk. So our babies, unfortunately, are being born into the world with the toxins that we carry. Then on top of that, there are potential toxins that the baby is exposed to, when the baby is born. And that could be food related, it could be medication related, etc., environmental related, etc. And so for myself, I was born with eczema. And one of my issues was some of the toxins that my mom carried on to me. So that's a big way that we get toxins. We also, of course, get toxins from our environment, which are so many, lead and mercury, aluminum, BPA from plastic, and pesticides and glyphosate and etc. The list is really just too long to list here that we are exposed to all these toxins. The second part of this is not only what we fill the funnel with, but what are we doing in our lifestyle, our diet, our lifestyle, etc., to really help this funnel to move and metabolize and really get those toxins out of our body. And then, our genetics also plays a big role too. If you look at your family line and you see there's a lot of eczema, asthma, chronic disease in the family, then potentially there's a genetic basis here. And then lastly, stress plays a huge role. If you are stressed out, for those of you with eczema, you know that if you get stressed out, your eczema usually flares. And that's because that funnel just stops working and the funnel starts overflowing. So I know that most of us don't see it this way. I know that your conventional doctor probably doesn't see it this way, your pediatrician, your dermatologist. And that's because it's really not conventional knowledge. And I'm really gathering this knowledge from healing myself and now working with hundreds of patients in my practice and really understanding that the root cause of mostly all chronic disease. And I think someone actually shared my post and crossed out eczema and said, all chronic chronic disease and like listed all these chronic diseases, because really, the root cause of all chronic disease really, boils down to this funnel really being full a lot of the time. And then all of us have different reasons this funnel is full, but oftentimes it is what's actually causing a lot of the chronic symptoms. And I like to call those alarm systems that are going off. They're really just telling us that there is a problem internally in our body, and this is the root cause problem. Okay. If you do want to learn more about the detox funnel, how to clean it, and all of that, I am actually doing a live masterclass tonight. I'm going to be showing slides. I'm really going to be digging in deep and really getting into the nitty gritty about teaching you about the detox funnel and how to clean it out. So if you're interested in joining that, the link is in my profile, and you can just click free live masterclass and you can join tonight. And I'm happy to answer all questions there tonight. And we're just really digging into the root cause of eczema, other skin diseases. And if you're here and you don't have eczema, I can talk about other chronic diseases and how it's related to the detox funnel tonight as well too. Okay. But I did open it up to questions, so I do want to answer those. The first question today was how to help infants, children with eczema since birth. So number one, we have to understand what is actually happening here. And if they've had eczema since birth, we really need to understand, well, what are the root cause reasons they have that eczema? And so some of the things to think about are the toxins that came from mom, the toxins they've been exposed to, after birth, the toxins they're currently being exposed to. What does their diet look like? Even for someone who's only 11 months old, is there something we can do to improve the detox pathways? What does the gut health look like? What does the kidney health look like? What does the liver health look like? We need to look at all of those things. What does the genetics look like? Is there a stressful environment that this baby is living in? All of these questions need to be answered. So how to help? First, we need to identify, what's the real problem here? And then one at a time, we really need to really target those issues. And oftentimes it's not just one issue. So, some people might say, oh, Dr. Fong, I took out gluten and dairy and nothing happened. Well, that might be one of the burdens you have on your system, but it may not be the only one. So we need to figure out, and oftentimes there's like 5 to 10 things that we really need to handle. Okay. Next question, should baby with eczema shower daily? Good question, and it really depends how severe the eczema is. If the eczema is really severe, I wouldn't necessarily recommend showering daily. I would recommend, a couple of times a week, and it depends. It just kind of depends on what the case looks like and whether, the skin is weeping and we need to cleanse the system. Sometimes if there's topical steroid withdrawal happening where the body has been exposed to so many topical steroids and now you take the steroids away, sometimes we want to avoid moisturizing and washing the body. So there's different reasons why you may or may not want to shower the baby every day. And it is a case-by-case basis. So I wouldn't say that there's like one answer for this, okay? And someone's asking, why do conventional doctors say it's eczema season? Does this have something to do with the cold weather? So absolutely, it depends where you live. So when it's cold, things change in the body. And of course that actually causes a type of inflammation, the cold. So some people actually get things like, hives and eczema when it's cold. It can get more dry. And so, with eczema, one of the issues is that there's something called natural moisturizing factor in your skin. And when it's cold and dry in the weather, sometimes those moisturizing levels come down. So, you may want to do something like a humidifier or something like that. Our diets change. What we do change is we don't go out in the sun as much during the winter. There's a lot of reasons why eczema actually does, for many people, get worse in the winter. If we can analyze what those reasons are, they might be different for every person, but we do see that people get worse in the winter. I also see people getting worse in the summer when it's really hot and they're sweating a lot, and a lot of these toxins are trying to come out of the system, and essentially the scratching is you trying to help those toxins out and you getting inflammation on your skin because those toxins toxins are trying to release. So I also see that as well too. I also see it a lot in the spring. Some people say, well, my eczema increases in the spring, and this might be because of allergy season that's coming up with the pollen and everything too. So everybody kind of has a different season that they have increased eczema in, but there's usually an answer for why it is for you, and understanding your reasons as to why you have eczema will help to understand why certain seasons actually tick your eczema off, okay? Let's see. Best everyday cream for baby under 1 year old with eczema. I really like, so I know dermatologists like to recommend Aquaphor. I really like Waxylene instead of Aquaphor for a number of reasons. The only problem is in Waxylene there is some soy in there, so if someone is really allergic to soy, that may be problematic. I also like Emu Oil, EMU. Emu Oil, Emu Aid. I think those are really easy things to get and try and see how those work for baby. Okay. Someone's asking, what should I eat on my detox? Any suggestion for food help? And I will be talking about this a little bit in my masterclass this evening. So if you're just joining us and you want to really learn more about the detox funnel, how to detox, I'll be getting into that tonight at my live masterclass. The link is in my bio. We also have a course, and a pretty inexpensive course that you can purchase on our website. And that course will teach you everything you need to do to detox. If you don't want to work with us individually, you can just kind of learn what you need to do, learn the diet necessities that you need. And I really don't like to call it a diet, actually. I like to call it a nutrition plan that you can kind of set up for yourself based on answering an assessment if you're doing the course, okay? If you're working with us individually, we have a team that will really help you with the nutrition plan and really figure out the best nutrition plan for you. On the team is myself, and we have a doctor of nutrition on our team as well too. Someone says, I never understood what exactly is toxins in the body. I hear and see it so much, and there's so many detox stuff, but what are we detoxing? This is a great question. I think that we often hear this, like, oh, you should detox, and what are we actually talking about? Well, we're talking about, environmental toxins to start off with. Your environmental toxin exposures could be things like pesticides if you're eating non-organic or GMO food. It could be things like aluminum in your cookware. It could be lead in your lead pipes at home. It could be mercury, which is in your metal fillings in your mouth. It could be mercury in your fish, your seafood that you're eating. It could be BPA and phthalates that are in the plastic that you're using to store your food or to drink out of water bottles. We are being exposed to toxins all the time. And unfortunately, a lot of these toxins we don't even know about. So in my practice, I really like to test these things. And that's something that I'll talk about tonight at the live masterclass too, is what are the tests that we use. So we like to use urine tests to look for these toxins coming out into your urine, and heavy metal testing and mold toxin testing. And there's so many toxins we're exposed to that we don't even know about most of the time. And unfortunately, in conventional medicine, we're also not testing for these things. So we're never uncovering these things for our patients. And that is a big part of what we do at Clean Body, is we really want to test to see, what is causing your system to be so congested, your detox funnel not to be moving correctly. Okay. What about babies with eczema? Was it things I ate while pregnant? Absolutely, it could be something you ate while you were pregnant, but that's really only one of the things that could be causing a problem with the baby with eczema. And oftentimes I see that it's a bigger part is the toxins that mom transferred onto baby. So often if I'm treating a baby, I will also want to know a lot about mom's health. If the mom is breastfeeding, I will also want to really treat mom as well too, not just baby, because it's important that if she's breastfeeding, she may be bringing these toxins into the baby's system, therefore burdening the system. And if we take it back to my story, my mom had all these amalgam fillings in her mouth. Those are made up of 50% mercury. Later, when I became a doctor, I checked her mercury levels and they were through the roof. And her pediatrician, my pediatrician when I was a baby, told my mom that I was allergic to her breast milk. And in reality, I was not allergic, I don't believe. I believe that I was actually getting, toxic overload from my mom's breast milk because she was giving me those toxins, which, largely could have been mercury in her system. Seeing that when I did test her later on, I saw that her levels were really high. I also remember when I was a child, I would scratch my skin and I would say, why does my skin smell like metals? And that was, I was excreting these metals out of my body. My body was doing a good thing for me. And so creating a really different relationship with your eczema is important. Understanding that your eczema is only an alarm system is really what I like to teach my patients. So if you want to learn more about eczema, toxins, how to detox these toxins out of the body, how to promote a really healthy operating detox funnel, then you can join my live masterclass tonight. It's tonight at 6:30 p.m. Pacific Standard Time. The link is in my bio. I would like to open it up to any questions right now. So if you guys have any questions, I'm happy to answer any of your questions. You can type into the comments. And I'm happy to answer any questions. I know having eczema is a journey, especially if you have kids with eczema. This is a journey that is difficult because you're watching your kids suffer. And you want to change your perspective on why your child or why you are having eczema. It's really an alarm system. So we need to understand why these alarms are going off. And there are lots of answers here. And it's usually not just one thing, as I said. It's usually multiple issues that could be causing those alarms to go off. So we really need to check off all the boxes one at a time to really understand which boxes really are a problem here. Okay, if anybody has any questions, please go ahead and type into the chat. I would like to answer those. I have rosacea and very bad eczema. Is this why? Absolutely. So rosacea could be definitely same root causes. Rosacea sometimes can be linked to also hormonal dysfunction as well too. So that's maybe something we want to look at. When the funnel is really full, your hormones also don't get metabolized very well. And so that's a possible root cause. But when it comes down to it, the detox funnel is likely overflowing. And that's why you have the eczema and now the hormones might be off and now the rosacea is happening as well too. So it usually comes down to there. Okay, definitely come to my masterclass tonight and I can really kind of delve into this for you and then also really kind of get more in detail about the rosacea and the eczema. Does psoriasis follow same logic as eczema or different? So it absolutely does. With psoriasis, there's kind of another step here. With psoriasis, typically there's autoimmune disease. With eczema, there might be autoimmune disease. So there isn't always autoimmune disease that's begun yet. With psoriasis, usually it's there. I would say in my psoriasis cases, I would say 99.9% of my psoriasis cases will show up with positive autoimmune disease screen. Psoriasis itself is kind of categorized as a more autoimmune condition, whereas eczema is not necessarily categorized as an autoimmune condition. So what does that mean? Psoriasis is kind of one more step in a dysfunctional place where there's a little bit another layer that we need to peel off, which is an autoimmune disease layer. With eczema, autoimmune disease hasn't necessarily started yet. An eczema person who's been dealing with eczema for a long time potentially could eventually have autoimmune condition, but not necessarily like a baby with eczema. Usually people with psoriasis will have autoimmune condition, which means your body is attacking itself. And we need to kind of reverse a lot of different things because usually when autoimmune disease happens, multiple layers of disease are happening already. Okay. Should you stop using steroid creams while detoxing? Is there a risk of TSW? So there's absolutely a risk of TSW anytime you stop steroid creams. When I work with people individually, we have to kind of think about this. I usually do like them to stop the steroid creams. I like them to wean off. And we might switch the steroid creams with something else because we want to start working on the likely TSW that's going to happen. For those of you guys who don't know what TSW is, it's topical steroid withdrawal. This is very common for people with eczema who have been using steroid creams. This actually happened to me when I was pregnant. I could no longer use my steroid creams and all of my eczema flared. And little did I know, because it's really not a well-known thing. It's called topical steroid withdrawal. Little did I know that I had topical steroid withdrawal, because that was now 14 years ago. And it was less out there in the world. We didn't have tools like Instagram and things like this where people were talking about it. So my dermatologist never told me about it. And extremely painful. You get red all over your skin. It's also called red skin syndrome. And it's something that happens if you keep using your steroid creams and then you stop. Okay. What type brand of daily sunscreen do you recommend if I have sensitive eczema? So definitely I would probably go to the EWG website. There is a cosmetic database, which is really awesome. And if you just go to the least toxic sunscreen that you possibly can use, that is what I would recommend for you. And again, EWG has a cosmetic database. Okay. All right. Well, thank you for all of your questions. Again, I'm happy to stick around for a couple more minutes and answer any more questions that you have about eczema, toxicity in eczema, the detox funnel. Also, again, tonight I am doing a live masterclass. It's about 45 minutes of information, and then I do stay around and answer a lot of questions. We'll get a little more in depth than we are in this IG live, because I'll be able to show slides and really get into it and explain, how do you get to the root cause of eczema, and you'll really understand all of that by the end of the masterclass. It's a power pack class, so I hope I get to see you guys there. The link to sign up for the masterclass is in my bio. All right, and I don't see any other questions coming up, so thank you so much for joining me today. And if you have any questions, you could direct message me. I'm happy to answer them as well too. All right. I hope you're all having a great lunch, and I hope you have a great rest of your day. And I do hope to see you at my live masterclass tonight. All right. Bye, everyone.